All right, so today we are going to talk about how you can increase your Social Security check. If you're new to my channel, my name is Ed Weir, former manager of the Social Security Administration. I ran the third busiest Social Security office in the country. Done this for a few decades, helped millions of people out with all things Social Security, Medicare, Medicaid, retirement, disability, survivor benefits. I've taken hundreds of thousands of those claims, and there's a lot of people that are missing money. And so we're going to talk about this today. And this is a live broadcast. If you're watching this later, I'm going to do a live Q&A. I'm going to talk about the topic of the day, which is how to increase your benefits. I'll talk about that. It should take about 10 or 15 minutes. So if you're watching this broadcast later and you say, I'm not going to spend an hour, it's not an hour. The six, I'm going to give you some bonuses. The ways to increase your check should take about 10 or 15 minutes. And then I'm going to open the floor to everybody out there that's waiting with questions. And we'll see if we can help them get all the money they are entitled to. So make sure you subscribe and come back when I do this live Q&A. So hopefully you will yell at me after 10 or 15 minutes and say, that was just a complete waste of my time, 10 or 15 minutes. I did everything correctly. And the Social Security Administration did everything correctly. And you are getting exactly what you're entitled to. So hopefully that happens. But unfortunately, there's too many people out there. And remember, this is not just about you. So if your check is correct and you did everything correctly and Social Security did everything correctly, then awesome, beautiful. We like that. But I guarantee you there's somebody around you that can need this help. Your relative, coworker, next door neighbor, lady down the street, whatever the case be, there are people out there that are losing benefits. We find money for people every single day. Okay, enough stalling. Let's get into it. Number one, COLA. People ask me all the time, do I get COLA? If I retire this time or retire this other time, what happens to COLA? COLA is automatic. As soon as they determine the COLA, watch out for the clickbait out there, all the COLA for this, COLA for that. Nobody knows what the COLA is going to be until the end of September. How COLA works is the third quarter of the previous year is compared to the third quarter of this year, and that's how they determine the COLA. And then it's completely automatic. Everybody, 70 million people that are receiving Social Security checks in one form or another, the computer system automatically goes in there and kicks in the 3.2% or 8.7% or whatever it is. I will say this. We've been missing 2% every year on COLA for decades. Contact your political representatives and say, hey, the COLA is wrong. I'm missing a whole bunch of money in my Social Security check. Why? Excuse me. Because the COLA, how it's determined, is determined based on the CPI-W. W is basically workers, younger workers. What it should be, and I think in the president and the current vice president, they both have this in their policy. I just did a video a few days ago about the comparison between the two candidates' policy in terms of Social Security. What it should be done, it calculated on, is called the CPI-E, E for elderly. Elderly people pay more into health care, and so that's a higher cost. If the COLA was based on the CPI-E for elderly, then you would get a 2% more every year. So that would have been, for 10 years, that's an extra 20% or so, right? So that's guerrilla math there, but quite a bit more than what you're receiving right now. All right. Number two, Social Security determines your benefit amount if regular retirement, based on your high 35 years of earnings. So a lot of people think it's the last year or last 5 years or 10 years or whatever the case may be. No, 35 years, not necessarily consecutive, the high 35 years. So Social Security looks at your record and says, okay, well, in the 20s, you were scooping ice cream, making $20,000, but they index that for kind of an inflation. So when you were 20 years old, making $20,000, scooping ice cream, that might be worth $80,000 today. And so that's important. Just don't discount those early, work years. And the key to make sure your benefit amount is correct, too many people have incorrect amounts, incorrect checks because they didn't check their earnings record. Go on to SSA.gov. There's the new system, the ID Me. You probably received an email telling you you've got to update your My Social Security account and everything. Watch out. There's some, in any time the government does anything, Social Security does something, there's some scammers out there that try to kind of jump on there and, send out similar emails. So just, be very careful. Go directly into ssa.gov and update your account. But once you're in there, make sure your earnings record is correct. If you have any if you have any gaps, then come back here and I'll tell you how to fix those. Those are some are very, very easy. Some of them are a lot more difficult. So that's why it's important. And please convey this to all your friends out there, your relatives, younger daughters, cousins, sons, that tell them every tax season, once they finish their taxes a few weeks after, go into their Social Security account and make sure those earnings are reflected in there correctly. Because if they're not, then they're going to lose money for the rest of their life. All right, number 3, military time. If you were in the military, when you filed for your retirement benefits, disability benefits, whatever the case may be, they should have asked you for your DD-214. Old Marine Corps sergeant here myself. It's not a whole lot of increase, but hey, a buck's a buck, and you paid for it. So make sure they added your military time to your benefit. How do you do that? Just call the 800 number and say, hey, was that military time added? And they should be able to tell you pretty quickly. Number 4, work. A lot of people think when they're on early retirement from Social Security or disability or SSI or spouse benefits or anything from Social Security that they cannot work. That is incorrect. You can. There are a lot of limitations. I've done several videos on that. I've done videos on working while you're taking early retirement, working while receiving Social Security disability insurance, working while receiving SSI. So make sure you check out those videos for all the details. But if you file for early retirement, 62, 63, 64, whatever the case may be, and you decide to go back to work, and you're working, and this year you're limited $22,320. Anything you go over that, Social Security holds back $1 for every $2 you go over. So if you call Social Security and say, hey, stop my checks, I'm going to be making a whole bunch more money. Or you just kind of let it ride and wait for the nasty gram next year that you have an overpayment that you went, over. What happens, this is called ARF, adjusted reduction factor. Social Security will look at that once you hit your full retirement age. So once you hit your full retirement age, Social Security computer system is completely automatic. They will look at your record and said, hey, this person is reduced for 30 months, a 30 months reduction because this person took their benefits 30 months early. But they worked for 10 months. So they should only be reduced for 20 months. So they worked for 10 months and we didn't give Social Security, didn't send a check for those 10 months because they worked. So Social Security, the computer system automatically goes in there and takes out those 10 months of reduction. And now you're reduced only 20 months for the rest of your life. So you get that back. It's called the adjusted reduction factor. That's 100% automatic. And there's another thing you can do. It's called voluntary delayed retirement credits. Not a lot of people do this out there. So if you go into a Social Security Administration and ask them about this, they'll look at you like a deer in the headlights because almost nobody does it. Probably because nobody knows it's out there, not even Social Security employees. When you hit your full retirement age, you can actually stop your benefits and get those delayed retirement credits. Delayed retirement credits are 8% every year up until you're 70. So if you're getting $1,000 at 67 and you stop your benefits, once you hit 70, you'll get 124%. So $1,240. So yeah, not a lot of people know about that out there. One thing I want to maybe not increase your check, but make sure you're not being ripped off. There's a lot of clickbait out there about stimulus checks and the old schoolhouse rock in terms of how a bill becomes a law and all that kind of stuff. There's a lot of low-level federal politicians out there that are trying to get votes, so they promise you free ice cream and unicorns and just to get their votes, and then the election is over and they don't do anything about it. And what happens is social media people out there grab that and they make this thing about you're getting $500 extra next month. You're getting, a whole bunch more money next month and next year, stimulus and all this kind of stuff. And it's basically just some proposal that just never went anywhere. But you clicked on the link and or the newspaper article, and you click the little thing that says I accept cookies, and then they got you. So be very, very careful. The big one, that are so many people, the number one thing that we're finding money for people out there through this channel is people are receiving the incorrect benefit type. They are receiving retirement benefits, but they should have filed for disability. They were receiving disability benefits, but they should have also filed for spouse benefits, or divorced spouse benefits, or surviving spouse benefits. They filed for retirement benefits, but they should have filed for surviving spouse benefits. They filed for surviving spouse, but they should. Yeah, so there's so many people. And this one takes quite a bit longer to explain, but I'm going to pop up. I did 2 videos on this. These are relatively recent videos. Um, this is I did a live, and then I edited the live to make it a little bit shorter, a lot shorter actually. Added some, sub captions there, some captioning. But this is the video right there, 2 checks. So basically people think, oh, I don't get 2 checks, I get 1 check. Within Social Security, you're basically getting 2 different benefits. If you're getting disability and survivor benefits, you're getting 2 checks. It comes at the same exact time, and one offsets the other, but it's essentially 2 checks. If you're getting retirement benefits and spouse benefits, those are essentially 2 checks. They're added together, but they're 2 different types of benefits. So a lot of people are missing that second check, and that's how we find a lot of money through this channel, is through there. So watch those videos, and if something clicks and you say, hey, wait a second, maybe I could get that, make sure you come on back, and then during the live Q&A and say, hey, Ed, I just want to confirm, am I reading this right? Could I get extra benefits? And we'll definitely help you out. All right, so the next is living on Social Security alone. As you know, a lot of people out there are just living on Social Security alone, and they're having a tough time. So I put together, before I worked for Social Security Administration, I worked for the Department of Welfare, old Marine Corps sergeant, many, many moons ago. So I've unfortunately spent most of my adult life in the bureaucratic beast. So I've put together all of the different programs that I know out there. So check out this video, how to live on Social Security alone. This is a shortened version of a 4 video set I did. That's a lot more details, but also a lot more boring. I kind of new to YouTube, so some of my videos are pretty boring. I apologize, but the information is good. But watch this one, how to live on Social Security alone, and I guarantee there's something in there that will make your life better. And I will put these 2 links in the description down below, and that way you have access to them. So after I finish the live, I'll put those links in there. Okay, let's see here. Let me get rid of those. All right, and then a bonus. So those are the 6. A bonus is don't waste your money on Medicare if you don't need it. People will say, you have to sign up for Medicare at 65. Yes, you will be penalized if you don't, unless you currently receive health insurance from work, your work or your spouse's work, your employer, your group health plan has 20 or more employees, and you're happy with it. But if you don't have that, yes, you do have to sign up for Part B at 65. The Part A is hospital, that it's 0 premium. Part B, $174.70. That covers your doctors. And then you have to find out a plan. Part A and Part B is great. You paid for it, but there's a lot of gaps. And so people either get a Medicare supplement plan or a Medicare Advantage plan. And if either one of those, if it's important to keep up on the Medicare Advantage plans. 51% of Americans have Medicare Advantage plans. And unfortunately, they are falling into the trap that these people that own the health insurance companies want you. They don't want you to be a shopper and shop around for the best plan for you. They want to give you your plan. You sign up for your plan and then forget about it. Because what happens is these plans, they change every single year. People always say, I've had the same plan for 3 years. No, you haven't. You've had the same plan for 7 months. because these plans, they expire at the end of the year. And a new plan, you might have the same card, the same company name, the same doctor, the same, whatever, but the plan details change every year. And next year is going to be the big one. There's a lot of different changes happening with CMS, the Center for Medicare and Medicaid Services. These companies are pulling out of particular areas, Southeast, Missouri, I've heard. A lot of different changes. So if you've never checked your plan, this is the time to do it. And if you need help, because there were so many people out there that not doing the correct thing, I decided to go ahead and put my own Medicare team together. So reach out to us, reach out to your broker agent. If you don't know anybody, reach out to us and we can help you out. If you want, I've got a link there. Click on that link and it'll say one-on-one Medicare help. And then once you click on that, it has a little option that says, I'm good now, but put me on your list for October. And then October, when the new plans come out, we'll have somebody call you that's licensed and contracted in your state with multiple companies, and they'll look at all the companies and they'll say, this looks like a good one, and here's what you got. Here's something, another option. Keeps your doctors, keeps your prescription, saves you a bunch of money, and then you decide what you want to do. All right, so second bonus is there's going to be a lot of other changes as well. We've got the Supreme Court ruling, the Chevron case. There's already changes coming by on that one. We've got the presidential election. So you got a lot of promises, some empty promises, some promises that have never happened, but we don't know. The new administration will come in and they're going to be making some changes. So there's a lot of stuff happening in Social Security and Medicare. So make sure you subscribe, and I will keep you updated on all those changes, and most importantly, how to take advantage of all of those situations that change. All right, let's go ahead and get into the questions. So I spent 16 minutes on that, so that wasn't too bad. All right, we already got a bunch of people asking questions. Lori, my first husband passed away and I was on his Social Security until my youngest turned 16. I since remarried and I just turned 60. Can I still collect my late husband's Social Security even though I remarried? No, unless you got remarried after 60 years old. So you were receiving surviving child and care benefits from your previous husband, the father of the child. So you were receiving child and care benefits until the child turned 16, and then your benefits stopped. So, but now that you've remarried, and it sounds as though you got married before 60, so unfortunately you will not be able to receive benefits as a surviving spouse on that particular person's record. The rule that only applies to survivor benefits, not okay. Looks like people are having a discussion and helping each other out. We like that. We like that. Hello, what's the cap when you draw widow's pay and working that a person can make? Thank you for your information. Hey, what's up, sweet bug? This year is $22,320. So basically, survivor benefits, you can start at 60 years old. And until you reach your full retirement age, there's a limit. Most of that time is $22,320. The year you reach your full retirement age, it triples. Like this year, it's $59,000 and some change. So Purple Love, yeah, please subscribe, like, and share. Yes, that's how the information gets out to all the people that need that information. So if I stop my benefits at 67 and then work until 70, I will receive 8% for the 3 years. Yes, 8% per year for those 3 years. And you don't necessarily have to be working. If you work, that will also increase your benefits. So, so if you stop your benefits at 67 and get those 8%, you'll get 8%, whether you're working or not. If you're also working and paying into Social Security, and that's one of your high 35 years, then Social Security automatically recalculates your benefit amount, and you might receive, you'll receive a COLA, you'll receive the delayed retirement credits, 8%, and you'll receive an increase of your PIA, your primary insurance amount, because you paid more into Social Security. So yeah, you get 3 increases, which is not a bad thing. Is it required to report how much you have in your checking and savings account when collecting SSDI and Medicaid? SSDI, no, doesn't. It's not a means tested system. SSI, yes. SSI, Supplemental Security Income, that's a welfare-based program. you would have to on that. But SSDI, no. Medicaid, if you're talking Medicaid, the welfare-based program, means tested system program from the state, health insurance from the state, yes, because that is a welfare-based program. If you mean Medicare, then no, you do not have to. Yeah, no relevance whatsoever. Robert, hello, doctor. Thanks for your advice. You're welcome. Is retiring early at 62 these days advisable? Yeah, nobody can tell you. There's a lot of people out there that do videos that says, hey, if you don't, if you don't start your benefits at 62, you're stupid and dumb and all that kind of crazy stuff. Now, there's too many variables. If you're working, making over the $22,320 substantially, then not a good idea. Your health, your family's longevity, do you need the money? Tax, is it going to put you in another tax bracket and increase? There's just so many variables. So yeah, it's really 100% your particular situation. So I've done a bunch of videos on, when you should take it and stuff, but those are the things. There's about a dozen things you need to kind of think about, survivor benefits and all the rest of it. So big one is IRMA after 63 going on Medicare. Government looks 2 years back on taxes. Yes, IRMA is the income related monthly adjustment out. It's basically an extra premium for high wage earners for Part B, Medicare Part B premium. If you sell a house, a retirement payout over 180K a year for a couple of Medicare monthly can be as high as 560. Yes, unfortunately, I don't know why, but Congress did not make an exception for selling a house. So if you sold a house 2 years ago, you got a lot of capital gains from it. Then yeah, unfortunately, you're going to have to pay that extra Part B premium just for 1 year. It's not forever. A lot of people think, oh, I got to pay this forever. No, it's just for that 1 year, unless you sell a house the next year or something. Yeah, but I don't know why they didn't make that exception. Aloha, Dr. Weir. I've applied for Medicaid. Okay, good. Sounds like possibly through the state of Hawaii there. So get your Kama'aina discount. I was stationed in Camp Smith in Kaneohe Bay in Hawaii. Went to the University of Hawaii there. Manoa, Kapiolani. I'm 60 and my husband died at the age of 48. We had been married for 9 months and he was on disability at the time. Am I eligible for survivor benefits? Yes. You were married when he passed away. You were married for at least 9 months. There's even exceptions there if he was in the service and died in the line of duty or it was an accident. But yes, if you're not currently married, and again, there's still the earnings limit. So yes, I would call it. It's the weekend, so call Monday or Tuesday and set up an appointment. So you call the 800 number. That's 800-772-1213, and set up an appointment to file for surviving spouse benefits. Absolutely. I've applied to Medicaid and didn't put in my SSDI benefit as income. I had a letter and they want me to send in a copy of my SSDI letter and count it as income. Is such a benefit SSDI as income? It depends on the state. I've had people that were in one state and they were receiving Medicaid. They moved to another state and they didn't receive Medicaid because of SSDI. Some states count it as income for Medicaid purposes, welfare-based purposes, means tests for purposes, but other states don't. Yeah, it's a state-by-state case, unfortunately. But in your case, it sounds like, yeah, they are going to count it. That's why they're asking for the letter. All the computer systems, they kind of talk to each other. So I guess in your state, they don't talk to the computer systems don't talk to each other as well. Dr. Ed is the man. Thank you. Quick recap. If turning 65 next month, the latest I can sign up for Medicare is 90-day correct. Yeah, you have 90 days for 90 days after. I'm on your list for October, new info coming out. You're a lifesaver. Appreciate it. Thank you. Yeah, you have that basically 7-month period. You have 3 months before the month you turn 65 and 3 months after to go ahead and sign up for Part B. But remember, you also you have to sign up Part A, Part B. If you don't have health insurance from work and all that, and then you also have to make sure you take some time to find the the plan that's going to cover all the gaps: Medicare Advantage, Medicare Supplement, all the rest of it. So, yep, reach out to us and we can definitely help you out. My wife is receiving disability benefits via her 86-year-old father's benefits. She is womb and never worked any hours. When her dad dies, does she receive her dad's full Social Security or retirement versus SSI? Okay, yeah, SSI is that's a welfare-based benefit. If her benefit amount is under $943 or so, then she'll receive SSI. But all right, let's answer the first part. Um, so receiving disability benefits, um, so she's receiving disabled adult child benefits, and as a disabled adult child, she's receiving 50%. When the parent dies, she can receive up to 75%. But yeah, when you receive, the reason I'm kind of hesitating here is you said my wife. When a disabled adult child marries, those benefits stop unless you are also receiving disabled adult child DAC. So a DAC can marry another DAC and everything is fine. But if a DAC marries a non-disabled adult child, then their benefits stop. So there's that. Do not see a link. Oh, okay. Let me pop the link up there again. So this is a little thing called Linktree. You go in there, it has all my links. It has how to schedule a private appointment and how to set up Medicare and the Affordable Care Act. I've got a team that helps with that as well. And even burial insurance, because $255 burial insurance from Social Security is, yeah, just doesn't do it, right? Let's see. My son was disabled and was receiving SSI and receiving Medicare. Should have been also receiving Medicaid as well, but okay. Someone asks if I'm not going to pop this up because I avoid Medicare insurance company names. I always want to stay neutral. I don't suggest one because even if I said, "Hey, XYZ Medicare Advantage plan is the best one," they change every single year. So, and these videos stay on on YouTube forever. So Ed said in my area, XYZ is the best, and this year that one is terrible. Ed doesn't know what he's talking about. Yeah, so I avoid it. It changes all the time, so that's why you need to check every single year. If you get a Medicare supplement plan, if you get like a G or an N, those stay the same forever. The only time you need to change is, if you have a G and you want to save some money and go to an N, which I always recommend N, or if you have a G and you like G and you just want to get a cheaper price, you can do that. But in terms of the coverage, it's all the same forever. Medicare Advantage, they change every single year. Well, they change continuously because the doctor networks change. You have to stay on the plan for a year, but the doctors can leave anytime they want. So I get people that, hey, I just signed up for Medicare Advantage, and last week my doctor was there and it was all cool, and now my doctor's not in the plan anymore. Yeah, that's the unfortunate part. But Juan asks if a particular company offering a Medicare Part B give back good and or permanent. Yeah, so they are CMS, Center for Medicare and Medicaid Services, Medicare. They're the ones that authorize health insurance companies to provide X, Y, and Z, and kind of regulate them. Well, they regulate them now, but now with the new Supreme Court ruling, I think health insurance companies are going to find lawyers so they can regulate themselves. But anyway, but CMS allows companies to provide different types of plans, people for Medicare and Medicaid, and chronic needs plans for people with heart conditions and diabetes and stuff. But they also provide plans that are called Part B Give Back, where it's a Medicare Advantage plan, and then the health insurance company, the Medicare Advantage company, pays for part of your Part B, that $174.70. They pay $50 of it, $100, all of it, depending on your particular area. So are those good or are those bad? They're very good in terms of they put more money in your pocket. So if you find one that pays 100 or 150 or all of it, then that's more money in your pocket. However, these health insurance companies don't get to be billion-dollar health insurance companies because they're stupid. If they're just going to give you money, if they're going to give you your money back, because all that money comes from all those decades you paid into FICA, so they're not giving you anything; they're just giving it back to you. So it's your money anyway. But if they're going to give you that money, they're going to take it from someplace else. So you have a regular old Medicare Advantage plan here that does not give that Part B give back, and you have one that has Part B give back. And this one, no give back, but if you go to the hospital, for instance, $20 a day. This one, you go to the hospital, it's $100 a day. MRI over here is $20. MRI over here is $200. So as long as you're going to be healthy for the entire year, and if you know you're not going to have an accident or fall or get sick or something, then hey, Part B give back, especially when you're young, 65, 66, 67, might be good, go on a little vacation and stuff, but be cautious. If something happens, then you might just be giving it back. So just be careful of those. A lot of vets use those because they use, I highly recommend those for vets that predominantly use VA medical facilities, and they just get the Part A and the Part are good for, the Part B. So yes. Um, Will they adjust the amount of SSI I draw because of my VA disability? SSI, yes. SSI is a welfare-based benefit. So if you get any other money coming in, yes, they will adjust it. All right, let's see. I was told that Social Security ran out on you and me as long time ago because it had to pay. Um, yeah, no, that's internet myths, politicians, Wall Street trying to scare you that Social Security is not going to be around, it's bankrupt, and all that kind of stuff. I've done several videos on this. The trust fund is still there, 100% present and or accounted for. All the money is still there. It hasn't been stolen or given to Ukraine and illegal immigrants and all that kind of stuff. It's still there. It's just it was there. It was built up for the baby boomers, and now the baby boomers are using it. That's the money they put away ahead of the game as a trust fund for when they got old. The problem is there's a demographic issue. Not enough young people, baby boomers and Gen Zs and X's or whatever, didn't have as many kids as we thought. And the rich are getting super rich, and they don't pay FICA taxes on their benefits. If you make, I'm going to do a video on this probably tomorrow or the next day. If you make $50,000, you're paying 12.4% into FICA, half you, half your employer. If you make $2.5 million, you pay less than 1% of your benefits into FICA. So that's why there's an issue with Social Security going forward. More money is going to the top that is not going into FICA. So do you recommend collecting at 62? I'm seriously considering 62. Yeah, same answer. Too many variables. Nobody can tell you whether to do it at 62. It's completely your decision. But again, make the decision based on your work, if you need the money, your longevity in your family. Do you have any other kids that need to get benefits on your record, and all the rest of it? So there's just too many variables. SSDI is considered unearned income, but still has to be counted. SSDI is considered unearned income. That is correct, but still has to be counted. It really depends what type of program we're talking about and what state. 164 watching, only 60 upvotes. Please, yes, people looking out there. All right. Because again, I can just make all the videos, I can make thousands of videos, but it doesn't do anybody any good until y'all share and like and all that kind of good stuff. When I start drawing Social Security, will they reduce that amount because I'm drawing 10% VA disability? Absolutely not. VA doesn't affect Social Security at all. Nope, no problem whatsoever. Go for it. At 65, I'm retired military. I have to sign up for Medicare to get TRICARE for life. My wife is younger. Will she still be on my TRICARE Prime? Yeah, I'd reach out to TRICARE, but I'm sure, yeah, that continues. But yeah, for TRICARE, they mandate you to sign up for Part A and Part B. It's just typical bureaucracy type stuff. One government agency is trying to move costs onto another government agency. Son was denied SSI benefits as an adult in overpayment. Request for waiver denied. What can I do? So denied for SSI benefits, but then there's an overpayment. So did you wonder where the overpayment came from if you never received any benefits? But yeah, you always have an appeal rights. Watch my videos. I've done 3 or 4 videos, particularly watch the new ones on overpayments, because the new commissioner, based on that Anderson Cooper 60 Minutes episode, they changed the policy on overpayments, made it a lot easier. What is the eligibility for Medicaid at the age of 65? Not sure what Medicaid is. That we talking Medicare or Medicaid? I'll assume Medicare. Eligibility for Medicare at the age 65. If you paid into Social Security at least 40 quarters, 10 years, then you are automatically eligible for Medicare Part A and Part B at 65. But remember, if you have health insurance from work, your work or your spouse's work, and more than 20 or more employees, you do not have to sign up for Medicare. But if you don't have that, then yes, you have to sign up for Medicare. If you don't, you get a 10% penalty for every 12 months you did not sign up for Part B. So if you're currently receiving monthly Social Security benefits, you don't have to do anything. About 100 days before you turn 65, Medicare will send you your package in the mail. But be careful. I was talking about those cookies. When you go onto these websites and click these cookies, that's how every company, these giant data broker companies, know what you're looking at and how old you are and what you want to buy and stuff like that. That's how they get your information when you turn 65, and everybody in the country starts calling you and sending you mail and all this kind of stuff. And some of the mail you receive looks official. What I see happening is people, when they turn 65, they're tired of all this junk mail coming in. So they just start throwing it away that says Medicare. And a lot of people throw away their Medicare card, the official Medicare package. So make sure you don't do that. But if you're not receiving Social Security benefits, then you actually have to file an application. Go online or call the 800 number and start your Part A and Part B. And then again, you have to get a plan, a Medicare Advantage or a Medicare Supplement plan. So find a broker or agent. And someone asked me yesterday, what's the difference between an agent or broker? So I'll answer that question. Hopefully that person is watching right now. Medicare agent, any insurance type of thing, and a captive agent, particularly, people use these names interchangeably. So, but a captive agent works for one company. So they work for XYZ Medicare Advantage plan. So when you call them and ask them what's the best plan is, guess which one they're going to tell you. It's like the old Henry Ford. You can have any color car you want as long as it's black, as long as it's our company. A broker doesn't work for the insurance companies. They work for you. They're contracted with a lot of insurance companies. So when you call them, they're working for you, and they're saying, hey, okay, what doctors do you want to continue seeing? What's your prescriptions? What do you need? You need more dental, vision, you need gym membership, yada, yada, whatever. And they find out what you need. And then they look at all the dozens and dozens of companies and dozens and dozens and dozens of plans. And they narrow it down to 1, 2, 3. And they say, here's the best one for you. And then if you like it, you enroll. And that's a free service. No agent or broker in the country charges you for that. If you like what they recommend, then they enroll you in that particular company, and that company pays them directly. So, but they pay them the same regardless of what company you pick. So there shouldn't be an issue. But there is a caveat there. There was the Supreme Court Chevron ruling, one of the first cases. There is what's called a little steering that has been happening in the industry, where some companies they don't they don't pay more than the regulated rate, but they have these extra little things. Hey, fill out this form and we'll give you $100. And then, so they kind of played with the law a little bit there. And these big companies have been paying agents and brokers to steer you to ones that they like. Um, Center for Medicare and Medicaid Services, Medicare, said you can't do that. They made a regulation, government regulation said you can't, steer people to ones that the agent is going to make more money. I think that's a good regulation. But there is a judge in Texas that says not so fast. So long story short, be careful. Make sure whoever you have help you with that, is above board. All right, let's see here. For an adult child disabled before the age of 22 and able to collect on parents' record, can the adult child continue to collect if they get married? It depends. They can, if they married another a disabled adult child. Because basically, and does it matter if the parent is alive or deceased? No, it doesn't matter if the parent is alive or deceased, but a disabled adult child, in order to continue to get those benefits, they're essentially kind of disabled adult child. They're dependent on their parents' work record. So if that child starts to work and gets insured on their own record, then they can no longer get disabled adult child benefits. They get kicked off there after a certain amount of time. And the way Congress wrote the rules is basically, if you get married, you are no longer kind of dependent on your parents. You are now a separate entity. And so that's why the benefits stop if you get remarried, unless you marry another disabled adult child. So all this stuff is confusing. I understand. There's over 20,000 pages of Social Security policy. And yeah, so unless you've worked in the belly of the beast, and there's a lot of people out there on social media that claim to be Social Security experts that never took a retirement claim in their lives. And so, yeah, it's giving so much incorrect information. Does my military benefits affect my survivor benefits? Nope, not at all. Thank you for what you're doing. Because of your channel, I learned of the possibility of getting benefits from my deceased husband's account. Appointment in 2 weeks. Yes, there we go. Awesome. And remember, it's not me. It was Sid Luscious and Taken Took and Sweetbug and oh gosh, I'm forgetting a whole bunch of names here. Yeah, all the regulars and all the people that liked and shared, and that's how you found that money. So thank you to all of them. Let me see here. When I start drawing Social Security, will they reduce that amount because I'm drawing 10%? Okay, I already answered that question. Common law married for a little over 12 years, but how do I verify that with no marriage license? Yeah, if you have a marriage license, that means it's not a common law, that's actual marriage. You go into schedule an appointment with the Social Security Administration, and the Social Security, in that 20,000 pages of policy, they have the state laws for common law marriage for all the states. And so be careful of that, because just don't call Social Security and talk to the person that picks up the phone, because those are lower level, called customer service representatives. You need to actually schedule an appointment and go see what's called a Title II CS, Title II of the Social Security Act claims specialist, a retirement specialist. And they will look at the policy for your particular state where you alleged your common law took place, and in the particular years, because some of these states, in the 60s, they had common law, and then they changed law in the 70s. So if you're, alleged common law in the 60s, you're good. But so each state is a little bit different. Social Security has to, because marriage and divorce is a state, thing. So Social Security has to abide by state laws in that particular case. So call Social Security, schedule an appointment, and tell them that, and see if you can get some more money. Question number 2, for a friend. There we go. That's what we like. For a friend, for a relative, for the little old lady next door. That's perfect. I like it. Assuming there's money there, is she eligible to receive survivor benefits from her deceased husband's account, who turned out to possibly be a bigamist? Yes. Um, that one gets kind of difficult, but yes, it's kind of a not a deemed marriage, punitive marriage. Yeah. If she went into there with, I'm trying to remember the exact wording of it. Um, but yes, if she did it as good faith and all that kind of stuff, so that's going to be a little bit difficult. But it is possible. Yes, absolutely. I've had those before, and yes. So tell her to, again, schedule an appointment. Just don't pick up the phone and ask them at Social Security, because this one is very difficult. And depending on who you get, hopefully you get a claim specialist that does the research. This is unusual. Social Security employees love kind of doing research on these strange ones like that, because it breaks up the monotony of all the 10,000 easy retirement claims. But it really depends on who you get. So file, and if she's denied, come on back and I'll show you how to do the reconsideration. It's pretty easy, and how to argue that. My husband passed away in 2021. I've never applied for the survivor benefits. I'm FRA now, thinking of applying for survivor benefits now. May I also be eligible for the 6-month retroactive widow benefits? You can always try. Always try for retroactive. Always, 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 always say, hey, and particularly if you called. If you called last month or 2 months or 3 months ago and you asked a question and whatever, say, hey, I called you all 3 months ago, and so I want my benefits to start then, plus maybe 6 months back. Usually after your full retirement age, you can definitely do that. But it doesn't hurt to try in your particular case. It might be difficult in this one, but always, always, always try. Um, but yes, remember, if I'm not sure if you're receiving benefits on your own record, because remember, you can receive survivor benefits and you don't have to file for benefits on your own record. You can get the survivor benefits and let yours increase. Um, and or and then once you receive survivor benefits for a while, you let yours increase and then pop over onto your own. So, but if you're already receiving retirement benefits on your own, then you're just going to add benefits on top of that. That's where that I was talking about the two checks. People don't think it's two checks, but internally it is two checks, two accounts, two BICs, beneficiary identifier codes. Does Social Security payments pension affect my Social Security amount benefits here? Is there a windfall? Not does Social Security affect my Social Security? Not sure what that means. Does a pension, let's say you're asking, does a pension affect your Social Security? It depends if that pension comes from non-covered work. That is, you work for a state, local, city government that did not pay into Social Security. In that case, possibly yes. It depends on how many years you actually paid into Social Security. Oh, okay, here it is. Here's the second part of it. I get a pension, Social Security. Oh, okay, from pension. Okay, that's what it means. Okay, now I understand. Okay, from Europe, will that affect my Social Security payment here in the U.S.? Any windfall? Yes, possibly, but there are Social Security has what's called totalization agreements with every country, so it really depends on what country. So you file for benefits and you make sure you tell them that you're going to get a pension from whatever country in Europe, and they will look at the totalization agreement. You'll probably need proof of that pension amount from that country. So, and then when you were entitled to the pension and when you became eligible for the pension. By the time I turn 62 next year, should I start looking into what my options are to be prepared? Yes. All right. I would argue that you should do that at 20 years old, but nobody thinks of retirement in the future at 20 years old. But yeah, absolutely. At 62, you can start your monthly benefits on your own record. If you have a spouse at 62 receiving benefits, you have a divorced spouse that's 62. Doesn't matter if they're receiving benefits. You can receive spouse benefits at that time. Your Medicare won't start until 65, so you have to figure out what you're going to do for health insurance. If you're working, If you're making over the 22,320 or whatever it's going to be next year, 23, 24 or whatever, then remember they hold back $1 for every $2 you go over. Hello again. My question: I applied for Social Security last year. My question was, when I applied, didn't include my husband because we were separated. However, he makes a lot more than I should have included him. It depends on what type of benefits. If you filed for SSI, the welfare-based benefit, then yeah, you had to have included that in there, regardless if you're living together or not. You need to include that in there. But if you applied for Social Security Disability Insurance, SSDI, nope, not an issue. Retirement, not an issue. Survivor benefits, not an issue. Spouse benefits, not an issue. Only SSI. My wife is going to file for Social Security next month. I will continue working. I have heard you mention spousal benefits. Is she eligible for that? Yes, once you start receiving benefits on your own record. But if you're going to continue working, then no. So she files for benefits on her own record, gets that money. And then when you file for benefits on your record, you start your benefits, then she can start her benefits as a spouse on yours. If your benefit, your full benefit, your PIA, your primary insurance amount, which is your benefit at your full retirement age, is twice her amount. My husband passed away in 2021. I'm full retirement age now and want to apply for survivor benefits now while growing my Social Security. We like it. Yes. Might also be eligible for the 6 months retroactive widow benefits. At what percentage? Yeah, the survivor benefits is kind of hard to calculate. It depends on if you're going to take them early, they're going to be reduced mostly. It depends on your deceased spouse, when they took it, were they receiving disability? Did they take it at their full retirement age, delayed retirement? Or so the best way to figure that out is call Social Security and apply for benefits. But you're fraud now, so I would definitely start at your full retirement age. Absolutely. And you're doing the right thing. Don't touch yours. Let yours increase. So absolutely. Way to go. I like it. Can I collect Social Security Disability plus VA benefits and be eligible for deceased spouse survivor benefits? Yep. VA doesn't affect Social Security at all. Thanks for all the good info. I will share it with all my friends. Thank you again. All right. Thanks, Bobby. Appreciate it. Yep. We definitely need to get the information out there. Social Security is not doing a great job, telling people about this. And it's going to get worse too. If a congressional budget, I just talked about this on a video. If the Congress is talking about cutting $500 million from Social Security customer service, and customer service of Social Security, that's their job, is to help you get the benefits you're entitled to. But if there's nobody there to do that, then you're going to lose benefits, unfortunately. So it's a kind of a roundabout way to cut benefits by not helping you get your benefits. So that's what I'm doing here in my semi-retirement, my new third mission in life. I'm 66 years old. I retired at 63 to take care of my mother with dementia. She passed. Now I'm 66 to make ends meet, got a part-time job. I am still receiving Social Security. How much can I make working? Florida. Hey, what's up, Florida? Once you hit your full retirement age, you can make $1 billion a month and no issues in terms of any benefits withheld. If you're 66, you're probably like 66 and 8 months or 66 and 10 months in terms of your full retirement age. The year you turn, so if you're turning your full retirement age this year, you can make up to $59,520 in the months before you hit your full retirement age. And then once you hit your full retirement age, make all the money in the world, doesn't matter anymore. So what is the retirement age currently? It depends on when you were born. It's going all the way up to 67. If you were born after 1960, your full retirement age is 67. There are some in Congress that want to raise the retirement age, which is essentially $1 trillion benefit cut. So 1959, 66 and 10 months. Okay, well, somebody thereafter. Thank you very much. Sorry for the caps, he says. No problem. Thank you very much. If you get benefits in November, will you still get COLA? Yes, everybody gets COLA. The computer system automatically calculates COLA for everybody. But obviously, your benefit amount has already included COLA. If you file this month, your benefit already even though you're not receiving benefits, it's calculated with the COLA increase in there. So, is there anything out there to help me? I was left destitute. Um, wow, sorry to hear that. Yes. Let me pop this up again. Let me take off. So this video right here, how to live on Social Security alone. Um, I just uploaded this about a week or 2 weeks ago, and this is I go through 40, 48, 49 different programs that might help you. So watch that, grab a pen and piece of paper, and listen to it, and say, "Oh, that might help me. That might help me." And then I've also done 4 videos on how to live Social Security alone, same title. They were longer videos. I talk about the programs a lot more, but I kind of updated and expanded it and made the video a little bit easier. My other video I did, the intro was like 10 times longer than it should have been, and everybody complained, which they should have. I suck at YouTube, so there's that. I'm getting better, getting better. All right. There's a lot of fancy studios and people out there that have all the fancy stuff. I don't have all the fancy stuff. I have decades of expertise and experience, though. Let me see here. Okay. My sister's husband passed away. He was 55. She is 52. What and when can she collect survivor benefits? She can collect at 60 years old unless she is disabled. If she is disabled, she can receive what's called disabled widows benefits from 50 to 60 years old. So if she's disabled, tell her to call Social Security and file for DWIB benefits, disabled widows benefits. If she's not disabled, the earliest she can collect benefits is 60 years old. Let's see. I am 65 on Medicaid in Virginia. If I apply for Medicare, can I keep my Medicaid? Oh, okay. Oh, so this person did mean Medicaid. I'm 65 on Medicaid in Virginia. If I apply for Medicare, can I keep Medicaid at the same time? Yes, absolutely. There are millions of people out there. Good question. Millions of people out there that are receiving Medicare and Medicaid, Medi, no problem whatsoever. And if you receive both, you're also eligible for a Medicare Advantage dual eligible plan. And if you've watched my channel at any time, you know that I always recommend Medicare supplements, Plan Energy, if it's in your budget. But if you're receiving Medicaid, Medicare Advantage dual eligible is definitely the way to go. You can get extra benefits, maybe some money to help with the electricity and over-the-counter type stuff. And those plans change every year. And if you're on, you don't have to wait for October. If you're on a Medicare Advantage dual eligible plan, you can change your plan several times a year. If you don't like your current plan, you can change it. If you're receiving extra help from prescription drug program, you can change your plan several times a year. If you move, you can change your plan. If your plan, what we'll see in October is there's going to be a lot of companies that pull out of areas. Millions of people are going to lose their plan because the companies say, well, we're just not making enough money on you guys. So they're going to pull the plan. So those people can obviously switch, and they might be able to switch to a Medicare supplement. Usually when you get a Medicare supplement, when you get a Medicare Advantage, it's difficult to switch to a Medicare supplement because you have to go through health underwriting and stuff. But there are exceptions. And one of those exceptions is if your plan completely pulls out of the area, we might be able to get you an exception to get a Medicare supplement plan. Again, if it's in your budget, I wish everybody got a Medicare supplement plan. If everybody did, then the prices would go way, way, way down. Well, what I wish is we didn't have to get a Medicare supplement and Medicare Advantage plan at all. I wish original Medicare that we paid into FICA for decades would cover all those gaps, and dental, vision, and hearing. But yeah, once I become the enlightened dictator of America, I will make that happen. Right after the cure for male pattern baldness. Vinger, you would need to receive. Okay, there we go. I appreciate Dr. Weir. Thank you so much for your time. I will be sure to set up a one-on-one with your office when the time comes. Perfect. Awesome. Yes. 99.9% of my help I do 100% free. Been doing these live Q&As pretty much for over 100 days. I missed one day. But I do private calls. I charge for those. That supports everything else. So if you want to do that, schedule an appointment. That the little link down there. Click on the link and set up a private call, and we can go through all your case and make sure you're filing correctly and getting everything you're entitled to. All right, let's see. Will Social Security do a medical review on me at age of 61? Yeah, if you're receiving Social Security disability benefits, then yeah, Social Security has the right to do a CDR, continuing disability review. And but I did a video on this. People freak out about the CDRs and stress about it and don't. It's a bureaucratic process you have to go through. Social Security does a bad job, or they do a good job of stressing you out. Because if you watch my videos, you'll know that the CDR is a budgetary issue. What happens is Congress writes essentially kind of a separate check for CDRs and says, okay, Social Security, we're going to give you this extra money to make sure people are actually supposed to be receive disability benefits. And this year we're going to give you X amount of money. So each office has to do 50 per month or something. So what happens is the offices send out 200 or 300 packages for CDRs because they know they'll only get 20% back, and they need to get their 50 quota. Because if they don't get their quota, yeah, they hear about it. I used to hear about it all the time, and we always made our quota. But the problem with that system, which was terrible, is we send out 200 packages, but we might not do CDRs on the other 150 because we got the 50 for that month. And so we've just freaked out. 150 people think they have to do the CDR, and they go through all this work, and we don't even use it. So I hated that system. That was one of the things I hated about Social Security, was that particular system. It stressed too many people out. So don't stress out. Even if you get the CDR, nothing might happen. So just fill it out, return it, and go on with your life. Ed, I would vote for your dear enlightened leader. Yeah. If I'm an enlightened dictator, I don't think I need to vote, right? I just take over somehow or something. Yeah. All right. I appreciate it. All right. That'll be it for tonight. If I missed your question, if I not able to get to your question, we're out of time. Please make sure you join me. I'll be back again tomorrow, and I'll talk about whatever topic